So we will continue with the classification of laparoscopic equipment. The first lecture we had was on the overview of minimal invasive surgery generally. So today we are going to talk on some of the equipment or instruments, because for you to understand how these instruments work and how they are being used, you need to really understand the principle behind operating the instrument and how they work for you to be able to perform a successful procedure. Now, this classification, you will see generally that there are several ways the instruments are classified, but I'm going to follow a simplified method which will be easily remembered, and so that we'll have a gross overview of what all the equipment look like. So at the end of the lecture, if you have any question, you can ask your question. Okay. Now, laparoscopic equipment or instrument generally are categorized into three. The first category is the imaging system. The second category is exposure and manipulation equipment or instrument. And the third category is the hand instrument. Now, this is a broad classification of the equipment. But for better understanding, we are going to discuss each of this category in a separate lecture so that we understand the principles behind each of this category. Now, the categories we showed here are placed, especially some of these equipment are placed on a trolley, a laparoscopic trolley, or a laparoscopic chart, or a tour. Now, this laparoscopic tour is a mobile storage and organization system that is designed to hold and manage laparoscopic equipment during surgery. Now, on this trolley or a chart, you have all the equipment, including the power cables. There are sockets installed on this trolley in such a way that there's only one output from the trolley connecting to a main power source. All other equipment are plugged into the sockets that are provided on this trolley. Now, the trolley typically includes monitor mount. You have a monitor mount where the monitor will be mounted, okay? So on this monitor mount, the video monitor is placed. Then you have, okay, sorry. Okay, the monitor mount is an adjustable arm or bracket to hold the laparoscopic video monitor. On this previous image, you can see the mount, the monitor mount. It is mounted on this in such that the screen is well displayed, okay? Sorry, I have a little challenge with the slide. Now, equipment shelves are storage space for laparoscope, cameras, light sources, and other accessories. There is a shelf on that trolley where you store all your accessories in such a way that you don't have to be looking for an equipment during a procedure. Now, cable management is what we just discussed. Now, features like cable tie clips or organizers to keep cables tidy and secured, okay? All the cables are clipped. Now, if the trolley is well packed, you won't even see all the cables because they will be packed behind a slot behind the trolley. And the power outlets is built-in power outlet or power strip to connect equipment. If you see the trolley, it has only one output that is connected to a main power source. All other equipment are connected on the trolley. There are multiple points of connection on the trolley. You have storage drawers or compartments, okay, enclosed spaces to store smaller items like instrument, gloves, and sutures. Then adjustable height and tilts allows the trolley to be positioned for optimal viewing and accessibility. So when you see a laparoscopic tower, you should ask of the Magnificent Seven, okay? In any laparoscopic tower or any laparoscopic trolley, you should look for the Magnificent Seven, which is the video monitor and the cables. Without the cables, you cannot connect the monitor to other equipment. So the video monitor and the cables, the endo vision camera and the camera head, we will discuss this shortly. Okay, so you have the camera, then the light source, the light source, and the fiber optic cable that is connected to the light source. Then the laparoscope itself, okay? Now, in most cases, you see the energy source in the trolley. either diathermy machine or other forms of energy sources. But the basic items the trolley should carry is the Magnificent Seven, as we mentioned. Okay? Now, let us look at the classification of these equipment. And because of the equipment are so broad, we will just discuss the imaging system of a laparoscopic setup. Now, this imaging system consists of a telescope, endovision camera. This endovision camera is also called the image processing unit or video processing unit. Then the camera head, which is attached to the telescope. Light source, fiber optic cable, and the video monitor. These forms the components of the imaging system of a laparoscopic equipment. Now we'll start with the first item, which is the telescope or the laparoscope. The telescope for laparoscopic procedures are called laparoscope. These are various, you can see images showing telescope and the tip of various degrees, 0 degree or 30 degree. Now we will see what the telescope is made of. It allows visualization of internal organs through the access point. Now it is this telescope that is introduced via the access point that picks up the image, transmits through the camera system to be viewed on the video monitor. It has an eyepiece, okay? The eyepiece is at the tip of the telescope or laparoscope. It has a shaft. Sorry, this is the eyepiece, the shaft, and the objective lens. Then it has a light post where the light source is connected. So the telescope or a laparoscope is the instrument used for visualization of the internal organs through the access point created for that purpose. It has an eyepiece, a shaft, objective lens at the tip, as well as a light post that the light source is connected to illuminate the view. Now, these telescopes are of various angles from 0 degree to 120 degrees. The angle of viewing vary from 0 degrees to 120 degrees. Now, but commonly, the ones that are used are 0 degrees and 30 degrees. In most of our laparoscopic setups, those are the ones you will see commonly. being used, the 0-degree and the 30-degree telescope. Now, the diameter also varies from 1.5 millimeters to 15 millimeters. Smaller caliber telescopes are used in pediatric surgery patients, while the bigger calibers are used in adult patients. In microsurgeries, where you want micro incisions, you can use smaller instruments, smaller telescopes in adults. Larger diameter transmit more lights, are used in adults, while smaller diameter in children. Now, within these telescopes or laparoscopes, there are rod lenses, okay, several rod lenses. There are lenses within the telescope. The rod lenses within the scopes varies from 6 to 18. More lenses can improve magnification and resolution. So if you have a telescope with more rod lenses, they have better magnification and resolution than those laparoscopes with fewer rod lenses within them. You should also note that the 30 degrees provides a total field view of 152 degrees as compared to 76 degrees in 0-degree telescope. So it permits greater latitude for viewing underlying areas of difficult anatomy. So a 30-degree telescope view wider range as compared to a 0-degree telescope. Usually, the 0-degree telescope is easier to handle, especially for beginners. The beginners use 0-degree telescope. Then subsequently, when they become more conversant with laparoscopic anatomy, they can now upgrade to a 30-degree telescope. Now, this slide just shows a diagram on how the view will appear on a 30-degree and a 0-degree telescope. If you look at this image here, the 0-degree is showing a target here, okay, that is within the view of 0-degree. But if you look at a 30-degree view, is providing a more wider view with some angulation beyond what a 0-degree will show. If you are looking at an appendix with a 0-degree telescope, this is what you will see. This is a 0-degree scope. You will see the stump and the base of the cecum, if you are looking at it from this view. If you are using a 30-degree, you can see it showing you the appendix, the cecum, and even the ascending colon. So you can see a 30-degree scope has a wider range of view. And don't forget, the wider the caliber or the diameter of this telescope, the more light it transmits and the bigger view it shows. The smaller the caliber of a telescope, the smaller view, but with a wider magnification. If you look at the screen, when using a 10 millimeter telescope, it has a wider view. If you are using a 5 millimeter, it has a smaller view, but wider magnification. Now, on this other image, you can see the views of a 0 degree, 30 degree, and even other forms of angles. As we say, it ranges from 0 to 120 degrees. Now, look at what the views are in the endometrium. You can see how the 30 degrees is seeing the opening of the fallopian tube here. So that is the first imaging device, which is the telescope. Now, this telescope is connected to a camera so that it can be viewed on the monitor, the video monitor. Now, the camera system of a laparoscopic setup has two components: the endovision camera and the camera head. The endovision camera provides a magnified, clear view of surgical field. Now, when you are doing laparoscopic surgery, the image you are seeing is a magnified view. Okay? You will see smaller structures appearing magnified. Smaller bleeds might appear as if it is torrential. It is because of the magnification. And this endovision camera has a sensor or a chip. The sensor or chip for the camera is called charge coupled device, CCD. Now, it is this sensor that captures image by converting light into charge. This charge are then transferred to be read out, creating an image. So you should know that your resolution of your camera will depend on the CCD. That is the sensor or the chip. And this is very important because when you see a camera and you read what is written on it or on the guide or the manual, you know exactly what you are dealing with. Now, it comes in single chip CCD. That means the sensor, it has only one sensor and all the colors are sensed by a single chip. And the line of resolution per inch or pixels is 400 to 600 line resolution per inch for a single chip CCD. Now, there's a 3-chip CCD that has a chip for all the color separations, unlike the single chip that combines all the color via one chip. The 3-chip CCD has a chip for blue, red, as well as green color. So you can see its resolution goes beyond the single chip CCD because it's at a range of 600 to 1000 line resolution per inch or pixels. Now, if the resolution is beyond 1000, it becomes a HD camera. High definition is a 3-chip. It's a 3-chip with a resolution of more than 1000 lines resolution per inch. And the common ones you see is 1080 pixels. So when you see a camera with a resolution that is greater than 1000 pixels, you know it is a HD camera. And it is the HD camera that is recommended for laparoscopic procedure because you have a clear view of what you are manipulating. Those with lesser resolution have poor view. As we mentioned, the laparoscopic camera system has two components. The camera microprocessor, that is the video processor unit that receives and transmits image to the monitor. Then the camera head that is connected to the laparoscope. You have the laparoscope connected to a camera head, and this camera head is connected to the camera microprocessor. And from this, it is transmitted as an image on the video monitor. So this forms the camera system, laparoscopic camera system. The camera head and the camera microprocessor unit, or the video processor unit. Now, this is what the camera head looks like. Now, it has a universal coupling mechanism, okay, that attaches to a standard eyepiece of the laparoscope or the telescope. Now, irrespective, it is called universal coupling mechanism because irrespective of the diameter of the telescope, it fits into this coupling mechanism, the head, okay? Because it is the diameter that varies, but the standard eyepiece remain the same. Whether you are using a 3 millimeter, it couples into the head of the camera, okay? So you have an adjustable knob here. This adjustable knob is used for ensuring focus, creating focus of the camera. Now, there are some laparoscopic head that have two knobs there, one for magnification and another for what do you call it, focus. More advanced head, you don't have to be pushing the word for magnification or pulling it out to zoom out. Rather, you can just magnify it, okay? So the grippable focus ring ensure an easy, smooth operation. C-mount lens are available, okay? The lenses are there. Now, there's a programmable, this handle here, there's a programmable function key. It depends on the product. Some of the products will have their white balance on the head, while others will have white balance on the endovision camera. Okay, some will just have the menu key and some adjustable key. So it depends on the product. But you should know it has a universal coupling mechanism here. It has a focusing knob and it has a programmable function key here. Then there's a cable that goes to attach to the camera. Okay, now this is the head of the camera, the cable, and the endovision device here. So the cable is just connected into this and you switch it on. That is all. So they are different products, okay? And they are just easy to use. You just connect the cable to the slots on the Endovision device, and the camera head will be connected with to the laparoscope. These are this is also another products. These are common products we see in most centers, Cal stores, Covidian product, that is Medtronic, or Striker product. These are common laparoscopic HD devices you see in some centers. Okay, how do you focus? How do you focus a laparoscopic camera? Now, focusing a laparoscopic camera, okay, it needs to be focused before inserting into the abdominal cavity. It is not when you are in the abdominal cavity you try to focus. No, it is focused before introducing through the access point. It should be placed at a distance of 10 centimeters away from the target. For a 10mm telescope, we said these telescopes are of various sizes, ranging from 1.5 to 15 millimeters. So for a 10mm telescope, if you want to focus, it should be placed, the objective lens should be 10 cm from the target structure. Okay. Now, while it should be 5 centimeter for a 5mm telescope, then you now rotate this knob. Okay, the knob will be rotated. You place the tip of the objective lens 10 centimeters in front of the target structure. Then you now rotate while viewing on the video monitor to see the sharpness and clarity of the image. That is how it's been focused, because if you don't focus, you have a blurred image. Now, after focusing, before introducing, you need to create a white balance of the camera. Okay, white balance should be performed before inserting into the abdominal cavity. Why do you do white balance? This is to remove added impurities of colors due to either voltage changes, the cleaning agent you use in cleaning your scopes. Maybe there are some scratches on the lens. It is done by placing a white object. Commonly, we use gauze in front of the telescope, okay, attached to the camera head. Then you now press the white balance button. You see a white balance button written either, depending on the product, either on the camera head or on the Endovision camera. You just press the white balance, and what you see OK displaying on the screen. It will show you white balance OK. It means the color separations are now clear. Now, the next imaging system we'll talk about is the light source. The light source is a high intensity, bright enough to illuminate the surgical site. Now, the idea of the light source is to be bright as the daytime, the sunlight, as if you are operating on a bright sunlight. That is the idea of the light source. But however, you know, if you have a very roomy cavity, you require more light. If you have a bigger cavity, you require more light. And to get more light, you use a larger caliber telescopes. Okay. Now, white light, color temperature around 5500 to 6500 K, similar to daylight, for accurate tissue color representation. Now, it should have a narrow spectrum, okay? Limited to visible spectrum, like 400 to 700 nanometers, to minimize tissue heating and reduce risk of phototoxicity. Now, it should have a high color rendering index. Okay, you have poor, moderate, and excellent. Color rendering index that is closer to 100 is almost giving you the actual color separation of the target structure you are looking at. So that is an excellent color rendering index. Now, it should have a low heat emission to minimize thermal damage to tissue and reduce risk of burns. It should have a stable output, shouldn't be fluctuating, consistent light intensity and color temperature throughout the procedure. Now, this light should be adjustable. It should have adjustable intensity, because sometimes when doing this procedure, you have, if the light source is too much, you have spillage of light. There will be spillage of light. So it should be adjustable so that you can reduce or increase intensity. Now, it should have a long lifespan to minimize need of frequent replacement. Now, it should have a compact size, fit easily into the operating room environment, and it should be sterilizable or disposable. Ensures infection control and convenience, so you can clean up the cable. Now, in laparoscopic surgery, a high color rendering index of greater than 95, that is excellent color rendering index, is essential for accurate tissue identification. You should never have any doubt when operating, okay? You should be able to identify a tissue, okay, and manipulate a tissue without any confusion or complication. There should be precise dissection and suturing, improve diagnostic capabilities, enhance overall visual clarity. Now, because light is absorbed by blood, any procedure which bleeding is encountered, more light is required, okay? And you should know, in bariatric surgery with large abdominal cavity will require more light. Now, what are the types of lights from the light sources? Now, of course, you know, it could either be a halogen light source, xenon light source, metal halide light source, or light emitting diode, LED. Now, the xenon has more natural color spectrum and is smaller spot size than halogen. Xenon is colorless, highly unreactive. Metal halides are reactive and difficult to handle, but LED can be used with a high definition camera. So LED is the most preferred, the most appropriate type of light source is the LED, light emitting diode. It's high intensity and brightness. It has a long, in fact, this long lifespan makes LED superior to other sources. energy efficiency and environmentally friendly, compact size and lightweight. Okay, instant off, on, off, and dimming capability, high color rendering index of greater than 95, low heat emission, and minimal thermal effects. Now, however, xenon lights are still used in some cases, especially when high intensity illumination is required for complex procedures. But xenon lights are less energy efficient and have shorter lifespan. Okay, you can see the lifespan as compared to LED of 50,000 hours. Now, how do you connect the light source to the camera head? As we mentioned, that camera head has a port that connects the light source. You use a fiber optic cable to connect to the camera head. And the fiber optic cable is a thin, flexible cable used to transmit light from the light source to the laparoscope. The fiber optic cable consists of 18 glass or plastic fibers. These fibers transmit light from light source to the laparoscope. Okay, light transmission core. You can see this is the light transmission core. Okay, purest silicon oxide possible. The central part of the cable that contains the fiber is the light transmission core. Now, the cladding, a layer surrounding the core that helps keep the light within the fiber, is also the optical sheet. It keeps the light within the fiber. Then you have the buffer coating or the outer jacket that protects layers. Okay, it's a protective layer that covers the cladding and the core. So you remember you have the core, which is the actual fibers carrying the light. You have the outer sheet, and then you have the buffer coat. All these cables, all these sheets are all within a plastic protective cable. Now, the fiber optic cable transmits high intensity light from the light source to the laparoscope. It provides flexibility, allows for easy maneuverability during procedure. It minimizes heat transfer. Okay, it has a form of heat absorbent property that reduce thermal spread and prevent tissue damage. It enhances visualization. It enables clear and bright illumination of the surgical site. Now, this fiber optic cable is designed to withstand sterilization. So it has an outer plastic sheet that is sterilizable, okay? We are not talking about autoclaving. We are talking about other method of sterilization, either enzymatic sterilization or use of glutaraldehyde, Sidex. So it withstand sterilization, okay, and can be reused. It resists damage from bending. So you shouldn't excessively bend or fold beyond less than 15 centimeter radius. Twisting, so during the procedure, it can twist without having any issue. It can minimally stretch without having any issue. But the most important precaution you take when handling the fiber optic cable is not to fold or bend at an acute radius of less than 15 centimeters, because it's going to destroy the fiber optic cables within. It provides consistent light transmission, okay, that ensures reliable illumination during the procedure. The heat generated is filtered by a heat filter. And you should note that the distal end should not be placed under the drapes or on the patient to prevent burns. Now, these are some precautions of use. You should handle carefully, avoid twisting, excessive folding, as we mentioned, beyond recommended arc, not less than 15 centimeters radius. Sometimes you go to the theater and you just see the cable hanging on the light source and having some form of twist. So in those situations, it is destroying the fiber optic material inside the cable, okay? Now, you should disconnect the cable first after operation. You don't just remove the telescope and shining light in people's eye. So avoid direct glare of the light emanating from the cable, okay, to exclude risks of retinal damage. Okay, you clean outer plastic coat with disinfectant before use. Now, the next viewing imaging device is the video monitor. The video monitor is the screen that we see the image that is picked up by the camera, okay? The telescope is introduced into the cavity, picks up the image, okay? The telescope is connected to the camera head. It picks up the image, transmits to the endovision camera that process the image and sends the image to the video monitor on the screen, which is now interpreted. A laparoscopic video monitor is a high-resolution display device that provides a clear and magnified view of the surgical site. Okay, now you should know that the image must be clear and it's a magnified view. Now, it should be nothing less than a HD resolution. Even if you are using other devices that are not laparoscopic video monitor, it should either be HD or 4K viewing device that is medical grade, okay, that cannot cause any harm by emitting some radiations, okay? So now it's a high definition display. It shows detailed images with high resolution, 720 pixels, 1080 pixels, or even 4K resolution. It's a flat panel display, thin, lightweight, and compact design. LED backlit, okay, energy efficient, and provides good brightness and contrast. It should be a medical grade device. It's designed for medical use, meeting specific standard for image quality, reliability, and safety. Now, it should have a wide viewing angle. It should have a wide viewing angle, allow multiple surgeons to view the image from different positions. Okay. Now, multiple inputs connections. It should accept from various sources. You shouldn't have a kind of a monitor that will have just one type of connector, maybe a USB. It's not compatible with several other devices. That's what differentiates a laparoscopic video monitor from a simple, just an ordinary monitor. The laparoscopic monitor will have several types of connections, not only USB, not only HDMI, DVI, BN, SN, so many types of connections that can be connected to various devices. Now, how is it positioned, the monitor? Where is the monitor supposed to be placed? It is positioned directly opposite and preferably about 3 meters from the operating surgeon on a mobile truck, okay? Or installed on a hanging rotating arm in such a way that the entire team can view the image. A second monitor could be used by the assistant, placed in the opposite side. So today, we successfully discussed the first classification of the laparoscopic instrument. We said the broad classification of laparoscopic instruments are the imaging system, in which we talked about the telescope, we talked about the endovision camera plus its camera head. Then we talked about the light source, the fiber optic cable, and the video monitor. So this is the first group of equipment. The second group of equipment, we say they are the exposure and manipulating equipment. To get exposure, you need insufflation with carbon dioxide to create a room. So you have the insufflator, which we will discuss in the next lecture. The insufflator that primarily uses carbon dioxide to insufflate the peritoneal cavity to create room for vision. Then there is the suction irrigation system. The suction irrigation system is also the manipulating and exposure device. Then the other group of equipment we'll talk about is the hand instruments. So they are all the hand instruments, the various types of hand instruments. We are going to discuss them. Now, after the modules of the theoretical aspect, we are going to have instrumentation for physical identification of all the various equipment for laparoscopic surgery. So because of the broadness of this aspect, we are going to divide the lecture on classification into two. So thank you all. If you have any question, you can unmute yourself and ask your question, or you drop a message on the chat box. Then we will now attempt to answer the question. Thank you very much. Thank you all. Okay, I saw one question says, why is 0-degree telescope, which has limited viewing angle, best suited for beginners than the 30-degree telescope, which has an extended view? That is a very good question. Okay. Now, if you look at this, let's go back to the angulation. Now, if you look at the 0-degree telescope, it will just give you a flat view, as if you are viewing the target site from the top. Okay, so it's very easy to understand what you are seeing. But for the 30-degree, it will go into curves and seeing angle beneath a structure. So if you are not conversant with the anatomy, it causes a little confusion. That's why some laparoscopic surgeons, especially this Professor Mishra, will advise people to even start with the 30-degree telescope so that they already used to that from the very beginning. They have no even contact with the or experience of using the what do you call it, the 0-degree. But the 0-degree telescope will just give you an overview, just like you are viewing from the top, a 90-degree flat view without any angulation. If you are looking for any angulation, you manipulate to look for the angulation. Okay, but the 30 degrees, the orientation and hand-eye coordination might be difficult for someone who is just a beginner. So that is the reason why it's why it's difficult for them. Another question, that the final image provided, how do we know the orientation? Is there a particular way to hold the camera to get the right orientation? Yeah, this is a very good question. Now, in the module, there is a course, there is a lecture that is camera handling by assistant. This is a very important aspect in laparoscopic surgery, because if the assistants don't know how to hold and follow the camera, the surgeon will suffer, and the entire procedure will be very lengthy. So there is a particular technique of holding the camera, which we'll discuss in detail. But you should know that if you are holding the camera, another challenge of using, why it's very difficult for a beginner to use the 30-degree telescope when the light source rotates. Okay, when the light source rotates and it rotates the tips of the camera, it will entirely change the orientation of that video you are seeing on the image. But for the 0 degrees, it doesn't do that. Even if the camera rotates, because the light source rotates the telescope, the image will still remain the same. So it's not going to be challenging for a beginner. Okay, so all this, we are going to deal with all this in the practical session, when you are seeing the image on the monitor and will be rotating the camera using a 0 degree and a 30-degree, you now understand why there is difficulty using that. But by and large, it's very important in knowing how to handle the camera and understanding the orientation based on the position of your camera, which is better demonstrated practically. What is the optimal temperature of the light source in the pediatric versus adult? Usually, the telescopes or the light source are well designed to filter excessive heat. Okay, so it will just give a warm temperature that is not going to cause any burns to the patient. It is when you expose the tip of that light source and it's on the patient, okay, unknowingly, that it will cause burn. But inside, as long as the light is going inside, that light is filtered. It's not a heated light that is passing through the telescope. So it's just normal optimal body temperature that will not cause any burns or injury in the patient. You will not feel any heat from the emitted light because the device is designed to give that. And if you look at the Kelvin that is given on an ideal light source, okay, we mentioned in the properties of an ideal light source, okay, it shouldn't go beyond color temperature around 5,500 to 6,500 Kelvin, I think, which will not cause any harm to the patient. Yes, any other question? If you have any question, you can unmute yourself and ask. Okay, it appears there is no any other question. So our next lecture is the continuation of classification of laparoscopic instrument. Now, it is very important you don't miss all this, because all these theoretical aspects will form the foundation of what we will do in the dry lab. So it is very important you understand the basic principles guiding all the steps, okay, from the instrument itself, in fact, from patient preparation, handling of the instrument, intraoperative, postoperative principles, and some specific procedures we are going to describe. So thank you all. In the absence of further questions, we are going to stop here. Thank you.